in India, every 4 minutes, an Indian woman is diagnosed with breast cancer. Now, the numbers might be high, but that means you lose hope? No, not at all. The good news is it is absolutely treatable, and 60% of women who have undergone breast cancer have fought through it and have recovered. We, in today's session, will understand more about it from Dr. Shipra, who has joined us, and she'll just set in, and we'll go ahead with the session. Dr. Shipra Gupta, MBBS, MD, DGO, gynecologist and infertility specialist, will be enlightening us more on how we can come together as a community and help the ones fighting through breast cancer, the survivors. Because here, this time, Redcliffe Labs promotes no solo struggle. As a community, as a family, we need to come together, support the ones fighting breast cancer. And people in and around are not aware of what is breast cancer, when to seek help. So right awareness at the right time is very, very essential for someone to be able to prevent this disease. We'll explore more and understand more from Dr. Shipra Gupta, who has joined us, and welcome to our live session. Dr. Shipra, it's a pleasure to have you among us.
Thank you, the family of the Redcliffe Laboratories, for inviting me today.
Ma'am, I think you're not like the camera position. You're looking somewhere else. If you can just place your phone a little twisted, then we can look straight. Audience, they are joining in. Please stay tuned with us as we set in things. Yes.
Is this okay?
Yeah, I think a little up. I think the camera is a little down, so it's now fine.
Is it okay now?
Yeah, it's better. It's okay now.
So more than looking, I think I need to be audible.
Yes.
More.
Yes.
So all of you people who have joined in, good evening. I'm Dr. Shipra Gupta. I'm an obstetrician, gynecologist, infertility specialist. But moreover, more than that, I am a life enthusiast. So do not get sick. Just live life the healthiest way possible. That's my mantra, and that's what I'm here for. To see, breast cancer, it's a very, very vast topic as a topic if you want to discuss it. But the importance of today's lecture or the interactive session would lie in knowing the importance of knowing how can we prevent the breast cancer deaths. All right. So we all know, or maybe it is imperative for me to make this understand right here, right now, that breast cancer is number one cancer all over the world. Up to 27 to 30% of the world population is having some kind of breast cancer. And in India, along with the cancer cervix, and they both are in women,
yes,
mind it, they are the leading causes of cancers and cancer-related mortality. So that is why we are here discussing. And if I talk about the amount, the prevalence of it, not in terms of percentage, but to the common person, approximately 1 in 8 minutes, one female in 8 minutes is dying of breast cancer. Similarly for cervical cancer. So this is the burden that we are having. And imagine if 1 in 8 is dying, how many are totally undetected or suffering or undergoing treatment or therapy, or maybe are just unaware about their disease, which they are just harboring right now. So yeah, the essentiality of knowing about the breast cancer, where to suspect, am I at risk, what should I do, how can I ameliorate my risk, how can I help my family in terms of knowing it earlier, not able to transmit it to my future generations, all that we are going to cover here.
Actually, true, ma'am. And actually, this is preventable, isn't it? If we take right measures at the right time, can we not prevent breast cancer?
All right. So here, Ritika, that's a good question. All right. So we need to know that some cancers are hereditary. That means they are genetically transferred from generations to generations. In that case, prevention may not be the target, but early detection through screening and through tests would be the appropriate thing. However, if we talk today about only breast cancer, uh, only 8 to 10% are the hereditary or the familial breast cancers. Up to 90% of the breast cancers, they are developing due to diet, nutritional, environmental causes or unknown causes. These are called sporadic cancers, and living in this age of radiation toxicity, the pollution at every level, at cellular level, I say, because of the pesticides, because of there is everything in this atmosphere that we're breathing, that we're eating, that we're living, that is causing rapid aging, mutations in the tumor suppressor genes. That is definitely getting that is what we are seeing as epidemic of cancers, various cancers. So yes, and then there are in the sporadic group, Dr. tell us about how do I know if I'll have cancer or not. So what we have done is that there is so many of studies, so much of literature going on. We have identified some of the risk factors, that who are the women or the men. Okay, mind it. It's very important for you to know that not only women but the men also can have breast cancer. So, and it is a red flag. So we need. There are some risk factors. See, aging, number one, breast cancer peaks around 50 years. So it develops from 40 to 60 years of age. Secondly, is obesity, definitely. The diet and the nutritional factors. Third is the interplay of the hormones. What do I mean by the interplay of the hormones is, suppose the age of the menarche means the starting of the menstruation, is early, and the age of menopause is late, and throughout this reproductive age group of the women has unopposed estrogen. That means progesterone comes from childbirth, breastfeeding, all those things. So the woman is nulliparous, means she has not born any children, or she's not breastfeed. There is some exposure of some kind of hormones, which is controversial topic. Still the research is going on, what kind of hormone replacement therapy has been given or not, or OCPs or not. But in general, some kind of hormonal disbalance has been there that puts the women at a higher risk of developing a sporadic cancer.
So I think there are a lot of men and doctors who are joining, and I see they are all commenting. So how many are basically, I would like to know from our audience, how many of you are reading about breast cancer or trying to help your colleagues, your friends? How many of you are open to talking about breast cancer? अगर आप अपने ये सेशन में हम लोग आपके साथ आपसे भी जानना चाहेंगे कि जब ब्रेस्ट कैंसर की बात आए, लोग अक्सर हिचकते हैं इस बारे में बात करने के लिए, वो स्क्रीनिंग के लिए नहीं जाना चाहते हैं, बात करने से हिचकते हैं. तो कितने लोग ऐसे हैं जो ओपनली इसके बारे में बात करते हैं, प्रमोट करते हैं कि, एंड हाउ मेनी पीपल आर ओपन टू टॉकिंग अबाउट इट? प्लीज पुट इन योर व्यूज. अगर आप जानना लाइक आपके थॉट्स क्या हैं इसके बारे में, आप अपने कमेंट सेक्शन में जानिए. हम आपसे भी जानना चाहेंगे कि आप क्या सोचते हैं इसके बारे में. अगर आपकी कोई क्वेरीज हैं या कुछ भी है, आप कमेंट सेक्शन में डालिए. We'll take those questions up. And how open are you to discussing about breast cancer, knowing about it, spreading awareness about it? Please आप डालिए comment section में. डियर ऑडियंस, तो मैम जैसे कि आपने अभी बताया कि ये कॉजेज हो सकते हैं, व्हाट आर द अर्ली साइंस दैट अ वुमन नीड्स टू बी माइंडफुल ऑफ, ताकि वो टाइमली प्रिकॉशन ले सके एंड हम उसकी स्क्रीनिंग टाइमली करा सके? तो प्लीज अगर आप हमारे ऑडियंस को बता सकते हैं इसके बारे में.
तो या So as a gynecologist, I am mostly concerned with women who are coming to me and telling me, doctor, I'm noticing. So first of all, be aware. Be aware. Breast awareness is what we say these days. Be aware of your breasts. And during the reproductive years, especially after 30, first of all, I would like to tell all of you and highlight the importance of knowing your family history. In family history, if I'm talking about, just in general, know about your parents, grandparents, masis, their children, and so on and so forth. Not only about the breast cancer, have they had it, at which age they have had it, but also about ovarian cancers, the cancers which may be related genetically to breast cancer, which include colon cancer, stomach cancer, pancreatic cancer. So having a good knowledge about your family is the first step. If there is a family history of any of these, then consult a doctor as early as possible to know your risk of developing a breast cancer. Have a counseling session with a genetic counselor or a primary healthcare provider or a gynecologist. Go to them, talk with them. For other women, after the age of 30, 35, be aware about your breasts. And we recommend breast self-examination for that. So it is not necessarily that you do every month about it, but when the lumpiness and the bumpiness of the premenstrual phase and the menstrual phase has settled, after you're over with the periods, the method I'm going to elaborate, I want you all to learn it in this session. If I'm able to just put this across, I think my job here is done. So, so the step number one to know your breast is check after the menses when they are over on day 5, day 6, day 7. Stand in front of a mirror with the hands on the hips like this. I hope I'm visible. If I'm
Yes,
not,
yes.
I can maybe stand with the hands on your hips like this, like this. Just look at your breasts, the size, the shape, the skin, the nipple area, and then raise your hand. Just observe if one breast is abnormally coming up, any nipple retraction is there. Or so first thing is inspection and then palpation. What is palpation? Using the pulp of the 3 fingers. I generally lie down because some women, the breasts may be heavy, and by lying down the breasts become little more accessible. So using the 3 fingers, the pulp of your fingers, you go around the breast in a way. Supposedly this is a breast, you're lying down, you start from systematically from one area, complete the 360 area, and then in the middle just press it and roll it, press it and roll it against the chest muscle wall. So if, see, you can feel generally the breast is soft. It's a soft or it's a mild lumpy feeling you can have. Now, a good example is to place a lemon. Lemon, you know how it will feel. You know, it will be firm, but it will be still pressable. You can feel the margins, maybe the lump will move along the breast. That is a lump. Okay. And suppose I put a walnut. How would it feel? It would feel like a hard, like walnut feel. It won't be pressable. So that is again a lump that you'd feel. Apart from both the sides of the breasts, by looking at both the positions and palpating them in a systemic manner, do palpate at the nipple and the areola part also. And also looking for the axillary lymph nodes, what we call in medical terms. You can say lump in the axilla. So just you can put it across the chest wall muscle here and against the humerus, that is the bone of the arm. Just feel if anything in the axilla. The lymph nodes of the breast are deep in the axilla. So with your fingers, go deep in the axilla, palpate if there is any lump or bump. You do not need to do it every month, but do it occasionally. Know your breasts. And if anything abnormal you see in the form of lump, in the form of discharge, whether it is watery, whether it is milk-like secretions, whether it is reddish, bloody, greenish, whatever it is, you just report it to a physician or a gynecologist, and then they will know how to, take it forward.
मैम एक ऑडियंस से हमारे तरह साथ क्वेश्चन जो जुड़े हैं उनसे क्वेश्चन आया है, इज लेट मैरिज द रीजन फॉर ब्रेस्ट कैंसर? तो अगर आप थोड़ा सा हमारे ऑडियंस के लिए इफ यू कुड जस्ट इन अ लेमैन लैंग्वेज थोड़ा हिंदी में उनको थोड़ा समझा सके कि क्या लेट मैरिज एक रीजन हो सकता है फॉर ब्रेस्ट कैंसर?
जैसा मैंने कहा, ब्रेस्ट कैंसर एक हार्मोन, हमारी ब्रेस्ट में ईस्ट्रोजन प्रोजेस्टेरोन हार्मोन्स होते हैं, और जिस तरह से हमारी स्किन के सेल्स रोज बनते हैं अंडर द इन्फ्लुएंस ऑफ मेनी मेटाबॉलिक फैक्टर्स, सिमिलरली हमारी ब्रेस्ट एक डायनेमिक टिश्यू है. इट इज अंडर द इन्फ्लुएंस ऑफ ईस्ट्रोजन प्रोजेस्टेरोन. सो when the estrogen is high, and progesterone comes in play in the later half of the menstrual cycle. So it is a very fine balance जो टिश्यू को नॉर्मल शेप में रखता है. अब लेट मैरिज का मतलब है लेट चाइल्ड बेयरिंग, एटलीस्ट एज ऑफ इन इंडिया. ओके, सो यस, in those cases what's happening is that the protective effect of progesterone which comes in pregnancy during lactation has not occurred. So that is why we say ki early menarche, late menopause, no childbearing, no breastfeeding, they all are risk factors for development of breast cancer. So yes, हाँ, आपकी question जायज है कि हाँ, late marriage, and since I am a fertility specialist, I will add over here that late marriages are number one cause of female infertility. So plan your life. There are wonderful scientific inventions where you can know your risk of breast cancer. Addition to that, you can know your fertility status, at least if there is no abnormality in your fertility status. Plan your life with great knowledge that is being presented here, that is there in this society now.
ये आपने बहुत सही बोला कि हर एक चीज के लिए प्लानिंग बहुत ज्यादा जरूरी है. How many of you agree to this?
Empowerment. Having information, planning is all empowerment. Is a power of female empowerment. So
exactly.
If you're planning late, that's no worry. Go for egg freezing. If you're planning late, no worries. Get whatever is required to your milestones in life, get them discussed. Everywhere, the counselors, doctors, financial counselors, everyone is there to help.
बिल्कुल. जैसे आपने कहा कि प्लानिंग जरूरी है, डरना नहीं है. लेट करना है आपको, शादी हो या कुछ भी, कोई भी चीज, इट्स फाइन, बट आपको वो प्लानिंग करनी जरूरी है हर चीज के लिए. आई थिंक प्लानिंग अगर आपकी रहेगी तो आप चीजों को प्रिवेंट भी कर सकते हो, प्रिकॉशंस भी ले सकते हो, एंड यू विल हैव अ फोरसाइट कि क्या होने वाला है. तो यस, planning is very very important. How many of you agree to this? Please put a thumbs up in the chat box and tell me that yes, we agree with you. I would want to see a lot of response from our audience. Put a thumbs up in the chat box. Let me know how many of you agree that planning is very very important to prevent things, to have a healthy lifestyle. Put in your response in the chat box. Okay, doctor, you've told about like pregnancy, you've told about late marriage, you've discussed all that. Ma'am, अगर हम बात करें breast feeding की, या मतलब जो women who plan to marry late, जो जब वो breast feed करते हैं, how is breast feeding impacting women, their hormones, and can that also lead to breast cancer? Does it have any impact? इसके बारे में जरा बताएं हम सबको. And I can see a lot of thumbs up coming in, so that's really nice. Yeah.
Right, so breastfeeding is definitely protective. One thing for sure, breastfeeding is protective towards so many things. Not only just breast cancer, so many reproductive organ cancers also it is protective. It is also protective towards the baby in development of future cancers. Do you know that feeding is, it's all, postpartum feeding is the best thing that you can give to the baby as to yourself as a gift of motherhood. So yes, the answer is yes, and you should do it as your conditions allow, as your support system and everything,
मैम, अभी आपने जैसे बताया था कि फैमिली हिस्ट्री, अगर किसी की फैमिली हिस्ट्री रही है, सो दे आर एट अ हायर रिस्क ऑफ बीइंग अफेक्टेड बाय दिस डिजीज. नाउ देयर आर लॉट ऑफ जेनेटिक टेस्ट आल्सो, लाइक BRCA1, BRCA2. सो हाउ कैन दीज जेनेटिक टेस्ट BRCA1 and BRCA2 help guide a patient in their in knowing about their risk for breast cancer, or how to prevent breast cancer through it? Please help.
All right. So that's a wonderful question actually. So I told about the hereditary breast cancers, And breast cancer is very much genetic. About 8 to 10% of the cases of the breast cancers are hereditary.
Okay.
Supposedly, so when a patient comes, he says, "Madam, मेरी mama को या मेरी बहन को breast cancer detect हुआ है. Please tell me how much is it I'm risk at, and what should I do next?" So in those cases, a detailed history about the detailed family uh, is important. And it is very important to know, for example, mother को हुआ है तो किस age पे? Was it an early onset breast cancer? If it yes, then definitely it's more, that puts you more at a risk of developing the breast cancer. Was it BRCA1, BRCA2 positive? If not, क्या जिनको कैंसर आपकी फैमिली में हुआ है उन फैमिली मेंबर्स का BRCA1, BRCA2 पॉजिटिव था? अगर पॉजिटिव था तो क्या देन यू आर अ कैंडिडेट फॉर BRCA1, BRCA2 पॉजिटिव. जिस आपकी फैमिली में किसी मेंबर को कैंसर हुआ है, क्या वो मल्टी सेंट्रिक था? क्या वो बहुत, not even a single focus of cancer was it there? Yes, then you're a candidate for BRCA1, BRCA2 testing. So American guidelines are there, US task force guidelines are there, which actually tell you whether you are a candidate for BRCA1, 2 positive and or not. And I would like to actually Redcliffe Lab has given me the opportunity to talk about it, and I had the really wonderful session of self-awareness also, because I also went back and read through it. Generally, the gynecologist's purview is just attending the patient who has come with a symptom, get the evaluation done, look at the women, and then maybe refer her, if it is a cancer, maybe refer her to a more specialized units of the surgical oncology or the breast care unit or something of that sort. So so talking about the familial cancers or the hereditary cancer, BRCA1, BRCA2 gene should be tested or not, whether you are not a candidate for the testing is to be considered after a genetic thorough evaluation with preferably with a genetic counselor, where the whole of the family chart we look at, not only the breast cancer genes, we look at the pancreatic, the colon, the ovarian cancers. If in a family of yours, not just the breast, there has been a history of ovarian cancer, then or you have had an ovarian cancer, then you are a part of BRCA1, 2 testing. If a male family member of yours has had a breast cancer, then definitely you should get a BRCA1, 2 tested in yourself, and so on and so forth.
So, okay, ma'am, now when like there are women who are detected who undergo that treatment, जो लोग ये treatment, when they are undergoing that treatment, what do you think? What are the feelings they have? How risky is it? And how is the treatment? If you can explain the process from biopsy, the treatment, and the ongoing process, the chemotherapies, what happens to the emotional state, the physical state, what are the bodily changes that one can witness, and what support we as a community can give them? It's a long question, so we'll break it into parts. But then, like what happens when a woman has to undergo the treatment? What is the process? कहाँ से start होता है? अगर आप थोड़ा हिंदी में हमारे layman language में हमारे customers को थोड़ा explain कर सकते हैं तो.
हाँ बिल्कुल. ये बहुत अच्छा क्वेश्चन पूछा है. मैं एक आउटलाइन या ओवरव्यू दे सकती हूँ आपको कि ब्रेस्ट कैंसर को कैसे सस्पेक्ट किया जाता है. कि कोई पेशेंट मेरे क्लिनिक में आई, शी सेज मैम मेरे को कुछ अबनॉर्मल फील होता है, आई फील अ लंप इन माय ब्रेस्ट, और देयर इज सम डिस्चार्ज इन माय ब्रेस्ट, और मेरी एक्सिला में कोई abnormal granularity I can feel. So the first examination is the clinical examination. The clinical examination का मतलब क्या है? मैं assess कर पाऊँ lump है, कैसा lump है? Is it mobile? Is it painful? Is it involving the skin? In which part of the breast tissue is there? Is it unilateral, bilateral? Is the axilla is involved or not? So clinical examination, and we are taught the tools to know which are the breast cysts, infections. There are many DDs. fibroadenomas, which are absolutely fine. They can sometimes just with the help of antibiotics we can treat them. Fibroadenomas do not need to even treat them. Just keep them following up. Sometimes patients come immediately after feeding, madam kuch hai. It comes out to be a lactocele, where the breast tissue, see the breast tissue has three primary structures. एक तो ग्लैंड्स होते हैं छोटे छोटे जिनमें मिल्क बनता है, एक डक्ट्स होते हैं जो उस मिल्क को निपल तक लाते हैं. इसके अलावा ब्रेस्ट में फैट होता है, ब्रेस्ट में लिम्फेटिक चैनल्स होते हैं, ब्लड वेसल्स होती हैं, नर्व्स होते हैं और कनेक्टिव टिश्यू होता है जो इन ग्लैंड्स को और इन मिल्क डक्ट्स को ब्रेस्ट से अटैच करके रखता है. सो कोई भी लंप कहीं पे भी बन सकता है, बट फॉर अ क्लिनिशियन टू नो व्हाट इज इट इन्फेक्टिव इज नॉट. सो अगर आपका निपल इन्वर्टेड है, अगर जैसे संतरे के छिलके की स्किन हो जाती है थिकेंड, नॉन पिंचेबल एंड लाइक डॉट्स विच सजेस्ट कि नीचे फ्लूइड है और कोई ना कोई चीज उसको लाइक फाइब्रस स्ट्रैंड्स आर पुलिंग बैक, these are the signs that are seen in cancers. Fine. So first of all, it is the clinician's assessment, and then comes the second assessment, which involves either a mammogram or an ultrasound, or in rare cases maybe an MRI. So what is a mammogram? A mammogram is just an X-ray. It is a modified X-ray of the breasts. The breasts are placed between the two plates of the X-ray where the X-rays are coming. One photo is taken when the breast is compressed like this, one photo when the breast is compressed like this. In the mammogram we are able to see the glands, the glandularity, the fibrosity of the breast, and if abnormally something is there, then it just comes up. Sometimes even in ultrasound it shows a fluid filled well-rounded structure which has got smooth walls, regular margins, totally there is no solid component inside which is seen as hyperechoic thing, then it means it's totally benign. So, and if there are suspicions on the mammo or on the ultrasound, looking at the lesion, the clinician would then take, if the clinician says that's okay, let's do the biopsy to confirm. It looks little not so benign, not so like a cyst or fibroadenoma. Let's take a core biopsy. So it's also a simple clinical test where we put in the needle, we numb the area of the breast, we take a needle, we put in the needle ultrasound guided, and we just take out the tissue. It is no cut, no stitch, no pain, no bleeding procedure. It's done in a clinical setting. Absolutely no anxiety about it should be there. And then when we take the biopsy, we send it to pathology to tell, is it a tumor? Can he see the cancer cells? What kind of cancer cells he can see? Whether it is coming from the duct, the milk glands, or some other part from the nerve, from the the fibrous tissue. There they tell us. Then they tell us about then how the diagnosis is made. Yes.
मैम तो बहुत सारे क्वेश्चंस आ गए हैं एंड यस, आप जिस तरह से जैसे क्लास में बच्चों को समझाया जाता है उसी तरह से आप समझा रहे हो. एंड आई फील हमारी जो ऑडियंस है, जो जिन्हें शायद कुछ भी नहीं मालूम, वो भी उस विद योर द वे यू आर, द जेस्चर्स यू शोइंग, उससे उन्हें पता चल रहा है कि हाँ ठीक है, इस तरह से होता है. मैमोग्राम क्या है उन्हें पता चल रहा है. BRCA1, BRCA2 जीन्स टेस्टिंग, इसके बारे में जिन्होंने शायद कभी नहीं सुना होगा वो भी सुन रहे हैं, उन्हें भी समझ में आ रहा है. तो बहुत सारे उसीलिए शायद like questions भी आ रही हैं यहाँ पे. Can a person with normal life, like can a person live a normal life after breast cancer? वो पूछ रहे हैं.
And I am an infertility specialist. Let me tell you, out of 100 patients, I do see 2 or 3 patients who are newly detected with breast cancer, and they have come for fertility preservation before starting the chemotherapy. Okay. I would really like to take this chance to highlight the importance that you can have a cancer-free survival with so much of wonderful medical marvelous therapies that are here. The excellent surgeons, excellent targeted therapies, immunotherapies. So much is going on, and also the fertility preservation. So I'll just take a minute here.
Yeah.
Just deviating from the topic. If I have young audience over here, who really want to, take their lives in their own hands and plan them accordingly. Do not worry about, the anxiety is inevitable. All the emotions are inevitable and they are justified. But you should know that 90% of the breast cancers, if they have not metastasized, if they are locally advanced, even then they are curable. We have means to detect through BRCA1, BRCA2, who are your family members who who are at risk, and your future generations. If they, you want to plan your future generations, now we have PGT, the pre-genetic testing, where if you're married and you want to and you are BRCA positive, but you haven't got your treatment as of now, but you want to know whether my baby will get this BRCA1, BRCA2 gene mutation or not, there are techniques called PGT, the pre-genetic testing, where you make an embryo, you take the biopsy from the embryo, know that this embryo is BRCA1, BRCA2 positive or not, and then maybe you get it transferred in your womb or not. So even to that extent, you can plan your pregnancy.
तो कितना एडवांस हो चुका है सब कुछ कि अभी आप अपने आने वाले बच्चे के बारे में भी, उनके ब्राका जीन्स के बारे में भी पता कर सकते हो. इट्स जस्ट दैट आपने जैसे बोला प्लानिंग जरूरी है, प्रिकॉशंस एंड अवेयरनेस. सबसे बड़ी बात है कि अवेयरनेस जरूरी है यहाँ पे.
So taking this talk further, once you have diagnosed कि ये कैंसर है, अब हमें उसको ट्रीट करना है. तो ट्रीट करने के लिए हमें ये जानना जरूरी है कि कैंसर क्या है, इसकी कैरेक्टरिस्टिक क्या है, ये कितना बड़ा है, ये कहाँ कहाँ पे प्रेजेंट है. अब हम इस कैंसर में एस्ट्रोजन रिसेप्टर्स पॉजिटिव हैं, नेगेटिव है, एक कर्व B2 या HER2 भी कहते हैं उसे, if that is positive or not. These all things help the clinicians to decide the modality and the sequence of your treatment options. And this is all done not by a single person. The breast units are there now in big hospitals, all of the big hospitals, where they stage the cancer. They do a PET CT scan to know whether it has advanced to the liver or the lungs or the brain or the spinal cord or the bones or not. Accordingly, they individually design a treatment modality in collaboration with medical oncologists who give chemotherapy, with surgical oncologists who do whose primary aim is to conserve the breast tissue as much as possible. The radiation, the medical oncologists, so many people are involved. Yes. And the radiation oncologist, the word that was not coming on my tip of the tongue was the radiation oncologist who has to give the radiation. So a individualized treatment plan for each patient depending upon their TNM staging, their hormone receptor positivity or not is designed, and it is executed. And every day new research is coming. The aim is to give the patient a healthy cancer-free life with maximum functional breast tissue. So this is the aim of all the specialists that are sitting there, and me as a gynecologist and as an infertility specialist, to raise the awareness that even if you're diagnosed with breast cancer, before starting the chemotherapy, there is hardly 14-day procedure which will not much increase the chances of it getting bigger or spread anywhere else. You can go in for your fertility preservation. You can preserve your oocytes, and you can then go for chemotherapy, because chemotherapy is toxic to the ovarian cells, along with the intestinal and the skin and the hair and everywhere else, the bone marrow. So yeah.
So I think a lot of audience, they are waiting with their questions. एक और question आया है मैम कि is stage 1 breast cancer curable? So Simran Rana asked this question. Yeah, hi Simran. So ma'am is going to take up that question. So please be there. So is stage 1 breast cancer curable? जी ma'am.
So yeah. So see, breast cancer is staged according to the curability only. So you know it's stage 1 and you know it's curable. The answer itself lies in your question. Even the stage 3 is curable. The question is the cancer-free survival rate. How much is it? The years we talk about the survival rate. in years of life, how much is it or not. And yes, after the cure of the cancer also, the patient is put on regular screening again, whether it has developed in the other cancer, in the other breast or not. And there are, yeah.
तो एक और वही आया था, like और एक क्वेश्चन आ रहा है, does exercise reduce breast cancer?
Exercise helps increase the oxygen levels in your everywhere, right from kidney to skin to muscles to bones to breast to brain, and wherever the oxygen metabolism is going to be more, it is helping to remove the toxins from the cell at cellular level. It's going to help your metabolism get better, your cellular repair mechanisms get better. So yes, exercises help in making the life definitely better.
There's one more question. Can extreme stress cause breast cancer?
See, cause casualty and the cancer risk. It's a very complex topic. Nobody can prove it because there are so many of redundant or confounding factors. But yes, everywhere, even in infertility, we say stress, wherever you put your, the brain's will, the power of will, that thing is going to improve in your life. So extreme stress, your life is going haywire, you are thinking nowhere, extremely stressed, not taking care of your regular eating, exercising, sleep schedule, hormonal schedules, your whole life is wrecked. What will it, we cannot say that it is causing cancer, but where is it going to be? It's physically, emotionally, spiritually, financially, professionally, I don't know. So yes, stress management is first thing. Whenever I see a patient, I talk about diagnosis later. I talk about their family, their life, their stress levels, so that at least I am able to talk with the person who understands me. I don't reveal the diagnosis. I understand the person first, how much they are in soup. Otherwise also. So to take them out from their stress levels is also part of, at least I think, doctor, if they can give the time, if they don't have the rush of the OPD patients, I think yes, stress should be reduced. Otherwise, counselors are there for stress management.
मैम एक और क्वेश्चन है, व्हाट आर द साइड इफेक्ट्स ऑफ दीज ट्रीटमेंट्स, लाइक केमोथेरेपी हो गया, रेडिएशन हो गया, जो हार्मोन थेरेपीज चलती हैं, व्हाट इम्पैक्ट डज इट हैव ऑन द फिजिकल अपीयरेंस, ऑन द मेंटल हेल्थ ऑफ द पर्सन अंडरगोइंग द ट्रीटमेंट? अगर आप लेमन लैंग्वेज में थोड़ा हमारे ऑडियंस को समझा सके इस बारे में तो.
See, it is a very, very sensitive part of one's life where they are diagnosed with cancer. Not support is needed. Medical treatment is one part, but as I just said previously, the support system is very important. So yes, there are side effects of chemotherapy, systemic chemotherapy. Chemotherapy काम करती है हर उस सेल पे जो रैपिडली डिवाइड कर रहे हैं. तो रैपिडली डिवाइड तो हमारे नेल्स भी कर रहे हैं, हेयर भी कर रहे हैं, स्किन भी कर रहे हैं, इंटेस्टिनल सेल्स भी कर रहे हैं, बोन मैरो के सेल्स जो रोज आरबीसीज और डब्ल्यूबीसीज बना रहे हैं वो भी कर रहे हैं, यूरिनरी एपिथेलियम भी कर रही है. एवरीथिंग इज डायनेमिक. आवर बॉडी इज a wonderful machine who is responding every time to everything around us, environment ke around. So yes, when we are giving cytotoxic drugs, they are affecting in terms of looks. You're going to lose your hair, eyebrows, everything, but it is all reversible and it is under close strict monitoring of the oncologists. They look at the platelet levels, they look at the HB levels. The second cycle of the chemotherapy is planned when they are able to recover from the side effects of the first one. So all being said, there is anxiety होना तो लाजमी है, लेकिन ये जानना भी एक बहुत बड़ा सुकून है, राहत है कि हमें अच्छे से देखा जा रहा है. मेडिकल साइंस में सब कुछ एक्सप्लेनेबल आज की डेट में होता जा रहा है, एंड द डॉक्टर्स इन द केयर यूनिट इज देयर टू ट्रीट अस.
एब्सोल्युटली. मैम, ये जो लॉन्ग टर्म इफेक्ट होता है, जो अ पर्सन हु हैज गॉन थ्रू इट, उनके मेंटल हेल्थ पे या फिजिकल हेल्थ में क्या, अगर आप हमें कुछ 5 ऐसे पॉइंट्स बता सके, क्या होता है ये लॉन्ग टर्म में उनकी बॉडी में, क्या ऐसे 5 चीजें हैं जो अफेक्ट करती है? जस्ट 5 पॉइंट्स.
सी, I don't say कि long term में apart from psychological, factors there is anything, of course. See, आजकल क्या हो गया है, अब पहले मैस्टेक्टमी करते थे, अभी एंजेलिना जोली ने BRCA1 BRCA2 gene positive था, and there were more than 60 to 80% chance of her developing breast cancer. She got both the breasts removed. But did we know? No, क्योंकि reconstructive surgery immediately हो गई. So her because she's in showbiz, her and of course of a male or a female, it depends. A lot of confidence, like a lot of psychological confidence comes from the appearance. So there are reconstructive surgeries. That's what I said. कि जो surgical treatments of breasts are now or nowadays, they want breast conservative surgeries. They want to make, that is why they are giving neoadjuvant chemotherapy in locally advanced breast carcinomas. यानी वो पहले ट्यूमर का मास श्रिंक करते हैं, फिर जितना ट्यूमर है उतने को ही निकालते हैं. वो जो ब्रेस्ट जिसमें से ट्यूमर निकल रहा है, अगर वो ज्यादा निकल रहा है तो वी कैन डू अ फैट graft repositioning. There are so many of techniques to, you know, just retain the functional anatomy or the functionality of that organ. And more medical science is evolving towards retaining the functionality of an organ who is diseased and, you know, who needs correction. So I hope in future, so there are no long-term things given the reconstructive breast surgeries are there. Unfortunately, recurrence rates are there. Unfortunately, agar metastasize ho gaya hai and there is a recurrence in the spine or in the brain, they can give radiation therapy. That way it can be taken care of. The patient has to be given a very strong support through family members, and then there are support groups outside as well. The people who have themselves gone through those stages, you know. And then there are federal laws which states that you cannot, if the person is diagnosed with breast cancer, you cannot fire them, or you cannot not hire them, or you cannot, they'll just go through their lives as normal as possible. And few companies also offer financial supports, though not in India, very common about the, you know, the insurance companies. But yes, the insurance companies are bound to give you the financial supports of all the treatments.
But what are the chances of recurrence? अगर किसी को breast cancer हो रहा है, उसकी treatment होगी, सब कुछ resolve हो गया, उसके बाद recurrence के कितने chances रह जाते हैं?
You see, this is a hard to tell question. It's because it depends upon so many things. That's what I said. कि क्या वो multicentric था, क्या वो BRCA1 BRCA positive tumor cell था, क्या वो triple negative that is HER2 new negative, ER/PR negative cancer tha. These are all the things that increase the recurrence risk of the cancer. That is why after the treatment, the patient is still asked to come in the OPDs or basically, actually, I just forgot one point which I really wanted to highlight was about the screening of the breast cancer. When we talked about the self-breast examination off and on, also after the age of 40, yearly mammogram is recommended till the menopause.
Till then. Okay.
Yeah. So
एक क्वेश्चन भी आया है हमारे एक ऑडियंस से, इज लंप, जो अगर आपके कोई लंप हो एक मेल चेस्ट में, क्या वो चांसेस इंक्रीज कर सकता है in males to have a breast cancer?
Definitely. That's a very important question that you have brought up at the back end of our talk. And yes, the males can have breast cancer. And if a male has breast cancer, there are chances of develop a breast lump. There is a very high chance that it might be a cancer. Go see your doctor immediately.
So, ma'am, males are also at a risk of having breast cancer, right? It's not just the woman.
No. And most of them, if the male has a breast cancer, it might be BRCA1, BRCA2 positive. So that makes one, the male, and the other family members also need to be tested for the genetic genes. Yeah. And another point,
yeah. Ma'am, people who may be having vitamin deficiencies, people who have, say, vitamin D deficiency, B12 deficiency, or maybe deficiency in mineral calcium, how likely are they to develop breast cancer?
See, vitamin D's role is now being studied in everywhere. and it has found to be playing a very important role in the cellular mechanism at the level of the cellularity. And vitamin D is protective. So I can say about vitamin E that it has been studied, and the research says that vitamin D is protective. And yes, these vitamins and the minerals are very important factors of the coenzymes that are enzymes means at the cellular level whatever the functioning is happening. For example, किसी चीज को हमें break down करना है तो उसका जो enzyme है उसको एक्टिवेट करने के लिए विटामिन्स बहुत इंपॉर्टेंट होते हैं. विटामिन B12 ना, फोलेट मैकेनिज्म, फोलेट हमारा इंपॉर्टेंट हो रहा है डीएनए और एनाडिन को रिपेयर करने के लिए. अब उस फोलेट को कौन एक्टिवेट कर रहा है? विटामिन B12. फोलेट तो है, B12 नहीं है. तो B12 नहीं है तो फोलेट क्या करेगा? डीएनए आरएनए रिपेयर ही नहीं होगा, तो वो सेल डाई हो गया, वो डाई हो गया या म्यूटेट हो गया. सो दीज आर ऑल थिंग्स दैट आर in research being studied, and unfortunately we are in this era where at every level, I say at cellular level, the pollution is there. We are consuming the pollutants in form of foods, drinks, perfumes, cosmetics. Everywhere these synthetic chemicals, they are going inside our body or being absorbed by the even the shampoos, the dyes. Everywhere we are having carcinogenic products. We are applying them, we are eating them, we are eating preservatives, everything. So can't really bacho from it, but yeah, the researches are going on.
Exactly. So मतलब ये जो आप बोल रहे हो, हम जो substance जैसे our environment around us, the food we are consuming and the pollutants, sometimes I'm unknowingly, like I am a person who's really addicted to drinking beverages. You know, I go home, the first thing I open my fridge and koi bhi beverage, sweet beverage, I just take and I have it. So these are risky.
I don't recommend putting dyes in your hair. They are the most carcinogenic. These things, even the bleaching agents, the cleaning agents, go natural. I've become a big proponent. अपने घर में make नींबू को डाल के make your own cleansers. Go natural.
वो कहते हैं ना, हमारी जो नानी दादियां जब करती थी, आई थिंक बीमार अब हम बहुत ज्यादा होने लग गए. पहले हम इतने बीमार नहीं होते थे क्योंकि हमारी नानी दादियां जो थी वो हर चीज में, अगर फेस पैक भी बनाना तो आई रिमेम्बर उपटन, बचपन में हम उपटन लगाते थे एंड द ग्लो वाज डिफरेंट. अभी थिंक इतने सारे कॉस्मेटिक्स लगा के भी हम उतने ग्लो नहीं करते जितने कि वो उपटन लगा के. दिवाली से पहले स्पेशली उपटन लगाना, फिर वो मुल्तानी मिट्टी, कितना कुछ हम लगाते थे, वो बहुत ज्यादा हमें हेल्प करता था. हाउ मेनी ऑफ यू agree, dear audience, please put a thumbs up जो agree करते हैं. how many people have actually applied Upton on your skin? जानते हैं हमारे audience से.
So studies prove or not, I am a big proponent that go organic, go natural.
It's very, very important.
Synthetic. Even the cotton clothes, embrace cotton clothes. I mean, like, the list can go on and on.
But I think everything. I also have a question here कि हमारी जो undergarments है, like obviously the inner that we wear, does that also have an impact on developing breast cancer?
I don't think so. That's not been proven. But one thing that I've seen is that synthetic nylon or spandex or the stretchy polyester or polyester things, they are doing much harm. Even in male infertility, I've seen because they're wearing tight underpants, these things, and I don't know, maybe the sperm count is going low in general in the population. I can't really comment medically or scientifically, but yeah, that may be a reason. The undergarment syntheticity, so many patients I've treated last month of fungal infections.
Okay.
Because of them, if you wear cotton, even if you wear nothing, I say still you're better off than wearing those nylon or spandex.
Okay. So I think everything, our environment, us in whole, everything impacts our body. One last question before we end this session: how can we as a community come together to help the survivors, the fighters, and spread awareness among the youth? One way in which we can do that as a community, and how we can lend mental and emotional support to the survivors and the fighters.
I think the younger generation is really doing very fine. The school programs should teach. We should go in the schools and spread awareness on. The girls are attaining puberty at 10 years, 11 years now. We should be talking to them about everything. At least I can talk about the women hygiene, nutrition, about development, about diseases common like polycystic ovary or something, or hirsutism, their facial hair, their appearance, their emotional complexes, and of course, I mean, like the school, we can do targeted community these things. Uh, Similarly, for middle-aged, reproductive age group women, where we, the women who are coming for baby giving, and we should do a routine pap smear for them at the first visit for the gynecologist. Talk about the cervical cancer. I would also like the opportunity here at this platform to tell people about cervical cancer vaccination.
Yeah,
It's the
sure.
first cancer which can be treated by vaccination. So know about it. Maybe a second session we can do about cervical cancer and its vaccination. So yeah, and like this symposiums and group discussions,
Yes,
we
exactly.
can, yeah.
Awareness is the key, as ma'am said. Like, awareness is very important. So we need to be aware, we need to spread awareness. We do not need to seclude people who are fighting breast cancer. It's very important that we as a community come together. हम best हम जो कर सकते हैं उन्हें help करें, उन्हें strength दे through our motivational words. There's nothing to fear in it. And सबसे पहले, before anybody has to fight through it, we can prevent it by spreading awareness about it, about talking about it. They would know in advance what measures to take.